And we're back on Second Street talking about waiting in the healthcare system, the long waits. What can we do about getting those wait times down? Let's start at the primary care level. Emmanuel, you were just talking about how our wait times in clinics to see a family doctor, or even if it's just like a general clinic, to see a doctor about a particular health problem, how that's quite high compared to the OECD average. Do you have any thoughts, Sabine, around what we can do to reduce wait times that people face when it comes to needing care at the primary care level?
Well, I mean, let's look at Switzerland just for another second. I mean, the OECD data shows that 88% of Swiss patients see their primary care doctor the day they request an appointment. Can you imagine that?
Hmm.
And only 12% are waiting longer, versus 60% of Canadians wait more than 2 weeks to see their family doctor. That's if they have a family doctor. I know living in Ottawa personally, it
Hmm.
took me about 10 years to actually get a family doctor, and I kept trying and I got on every government list, and I'm sure many of your viewers can relate to that personally. It's very difficult, but it takes, and even when you get a doctor, you're waiting 2 weeks just for an appointment, and it just it upsets me when I see things like 25% of Swiss patients are waiting more than a month for a specialist appointment. Um, Only 25% of them wait more than a month, and 60% of Canadians are waiting more than a month for a specialist appointment. This is ridiculous. And the reason this is
Hmm.
happening is because we don't release that pressure valve. Like I said earlier, we are so attached to our healthcare system the way that it is, that it's really difficult for policymakers to even talk about changing things. But I don't see why, because when you look at the numbers, I mean, Canadians are interested in this. And I know that Second Street and many other organizations have shown numbers where over 60% of Canadians are happy to look at alternatives because they are suffering and their family members are suffering. So there are a lot of different ways to approach this. You can privatize in different
Hmm.
ways. It doesn't have to be black and white like it's often presented by those who don't want it to happen. You can have the government pay for it. Like in Switzerland, the government is paying for your insurance, but your health insurance. But the health insurance has to, you can top it up if you want to. You can pay for more if
Yeah.
you like, and then the actual private sector is open to helping you out at the same time. So there are different ways to attack this. The problem in Canada is we refuse to talk about it.
Yeah, it's a bit of an issue, isn't it? And to your point there, that 60% figures, last time we polled on it, 61% of Canadians support keeping the public system, but allowing people to pay privately if they want to. And like you said, I mean, developed countries around the world do that. It's surprising that we have still not made that switch.
Yes, and we look up to these
Emmanuel, I want to
countries.
get your take.
Sorry, I was just saying
Pardon
we
me?
look up to these countries so much, right? We always say Switzerland this,
Yeah.
and all of these great Netherlands are so great. They're such a great healthcare system. They have a higher you know style of life than us, and then we say, "Oh, but we're not going to do anything that they do to make our lives better." It's
Yeah,
kind of
it's
ridiculous.
amazing. We marvel at their healthcare systems, but we don't try and copy what they do, right? Emmanuel, I want to bring you in on this. What do you think could be done to reduce wait times when it comes to people, I guess even just getting access to a family doctor, but also the wait time when they want to go and see that family doctor?
Yes, so there's many things that can be done because let's be real, there won't be one solution that is magically going to fix everything. But one thing that could be
Yeah.
done, because of course what we need ultimately is more healthcare practitioners. But that takes a really long time. So we also need to look at what can be done now to try to alleviate the problem right now while we train more doctors. One thing that could be done is
Hmm.
what was started in Quebec and that is now being rolled out in other provinces is nurse practitioner clinics. So you have these super trained nurses in Quebec, we call them super nurses, and these have the training, have the experience, have the ability to take take charge of some patients. So essentially doing the role of helping family medicine and taking charge of patients. So that's one way that can be done to try to improve access to primary care. Another thing that can be done is when you look at what was started in Alberta, which is very interesting, where you have pharmacist clinics. Because let's be real, a lot of requests that are being done when it comes to primary care and even in the ER, there's a lot of issues when it comes to prescriptions. And pharmacists
Hmm.
are actually even better than doctors to help with those issues. So if we extend the scope of practice of pharmacists and make it more available elsewhere in the country other than Alberta, then it could help alleviate some of the pressure in the meantime while we train more professionals.
Smart ideas. When we come back, we're going to talk about emergency rooms and how we can reduce wait times at that level. We'll be back in just a moment.